Hi, my name is Kiana Tebow, and I am a student at the University of Louisiana at Lafayette. I am in a health and sexuality class, and I will be doing a public service announcement on a disease called lymphogranuloma venereum. Lymphogranuloma venereum, also known as LGV, is an uncommon sexually transmitted disease caused by certain types of the bacteria called chlamydia. It is spread through having unprotected vaginal, oral, or anal sex. Lymphogranuloma venereum causes painful and swollen lymph nodes, which can then break down into large ulcers. The disease goes through three distinct stages as it develops. The first two stages may be minor, and you may not even be aware of any symptoms until you reach stage 3, called the genital anecdotal syndrome. There is treatment for this disease. Antibiotics that are commonly prescribed to treat LGV include tetracycline, doxycycline, erythromycin, and azithromycin. The best way to prevent this disease is by not having any sexual activity. That is the number one way to prevent any type of disease. When using latex condoms correctly, that can also reduce the risk of any transmission. You can also limit the number of sex partners you have and make sure that your sex partners are tested and they are treated. For the signs and symptoms in the first stage of lymphogranuloma venereum, after a 3 to 30-day period, a small painless bump, it will be filled with pus. It is going to form on the penis or the vagina area. The lesion often has no symptoms and heals without any scarring within 1 week's time. The second stage begins 2 to 6 weeks after the first lesion appears, and it consists of painful swelling of the groin or the lymph nodes. You may have fever, chills, or you may begin to feel fatigue. The third stage of the disease is called genital anorectal syndrome. Particularly in women, this stage may be the first time symptoms are ever seen. Symptoms are different. They do tend to vary from men to women. So you would want to get yourself tested if you see any of these symptoms. Next, I will begin to show you some photos of this type of disease. This is the first photo that I'm going to show you. It is the lymphogranuloma venereum primary lesion, which is presented on the ulcer of the penis. If you look right there at the tip of the penis, you will see a swollen area, and that is the infected area. The next photo I will show you actually is a part of the male's genital area, which I will zoom in there and show you a close-up photo of the swollen area. And I would like to thank you for watching my video. Again, this is a public service announcement on a disease called lymphogranuloma venereum. The end.